I want to begin by welcoming everyone to today's webinar. I know that folks are very busy these days and there are a lot of webinars happening all the time. So I appreciate you taking the time to spend the next hour and a half with us. We have a fantastic panel of business leaders, regional, national, and international business leaders joining us today for a very important conversation about the purchasing power of working age adults with disabilities. I'm very pleased to co-facilitate today's webinar with my colleague, Dr. Michelle Yin. She is with the American Institutes for Research, and I'm with the Institute for Educational Leadership, and we'll do deeper introductions as we get further into the session. But I'd like to begin first with some housekeeping notes for folks as you join. Fatima is going to talk to us about those housekeeping notes so you can fully participate. Fatima?
Thank you, Dahlia. Welcome to today's event. We hope that you enjoy this phenomenal webinar. The format for today's meeting is a presentation followed by a panel discussion. All of our attendees are in listen-only mode. You'll be able to submit questions in the question box on your GoToWebinar pane at any time during the presentation. And we do have a moderator who will, share that with our panelists today. As you can see, we have an ASL interpreter here with us, as well as closed captioning. So the link was provided to you in the chat at the start of the presentation.
Great.
I just want to make you aware of the recording notice in IEL in conjunction with AIR. We're allowed for the recording of audio, visuals, participants, and other information sent, verbalized, or utilized during business-related meetings and presentations. We are recording today, and so we will have this available for you to access in post-production. So thank you for joining, and I'm going to pass it back to Dahlia.
Okay, great. Thank you, Fatima. We're actually going to introduce our panel first, but I just want to let you know that we're going to begin with a presentation, a brief one from Dr. Yin. Then we'll move into panel discussions. After the panel discussions, we will then have an open Q&A time for everyone at the end. However, we have someone monitoring the Q&A, so if your question seems to align very closely with one of our predetermined questions, we will interrupt ourselves to answer your questions as well. So please, anytime you have a thought, share it on the chat or the Q&A. Now I'm going to ask our panelists just for a moment to share their video cameras and to introduce themselves. And let's start with Howard Arden.
Okay. Hello, my name is Howard Arden, and I'm the Talent Acquisition Specialist for Novo Health Services down in Atlanta, Georgia. We provide clean and sterile linen for hospitals, and we have locations from Pennsylvania all the way down to Florida. Prior to coming to Novo, I was the Career Services Manager for Jewish Family and Career Services, where we help people to become job ready, show them how to interview, how to put together a resume. So I've kind of gone on both sides, helping people to find job opportunities, including people who had disabilities, to now hiring individuals.
Great, thank you, Howard. And next we have Apurva Gandhi.
Well, good afternoon, everyone. This is Apurva Gandhi. I'm Vice President of Multicultural Affairs and Business Councils at Marriott International. A little bit about Marriott International. We're a big hospitality company with over 7,000 hotels around the globe. We're proud of our inclusive culture of always putting people first and welcoming all. Thank you, Dahlia, for inviting me to be here.
Thanks, Apurva. And some of us have heard of Marriott. And next we have Steve Pemberton. Welcome.
Hi, everybody. Steve Pemberton. I am the Chief Human Resources Officer for WorkHuman. We are in the rewards and recognition space. Prior to that, I served as the Global Chief Diversity Officer for Walgreens and Walgreens Boots Alliance. And during my time at Walgreens, I oversaw our efforts to advance the employment of people with disabilities, both in our distribution centers and in our retail locations. Real pleasure to be here with all of you and to be with this panel too.
Thanks, Steve. And we have Hale Pulsifer.
Hello, I'm Hale Pulsifer. I am the Vice President of Customer Accessibility Strategy at Fidelity Investments. Very happy to be here.
Welcome, Hale. And we have Dr. Michelle Yin.
Hi, everyone. My name is Michelle Yin. I'm a Principal Economist at the American Institutes for Research. At part-time capacity, I'm also a Director and Assistant Professor at Northwestern University. I've been in the disability field for the past 10 years, and I've led several large-scale federal and state evaluations for the Department of Labor, for RSA, to improve disability employment access and quality. I've been also working with Special Olympics to evaluate one of their signature interventions, Unified Champion School programs, to help improve social inclusion for children with disabilities. And having grown up in China myself, where we have segregated disability systems, I have natural interest in equity and social inclusion issues. So that's one of the motivators for developing this research brief series, and I'm really excited to be here to share some findings from 2 of the research studies and hear your thoughts on the findings and the future directions for disability employment. Thank you, Dahlia.
Great, thanks, Michelle. And my name is Dahlia Shaywitz. I'm Vice President for Transition, Disability, and Employment at the Institute for Educational Leadership. IEL has been around for 57 years. And doing equity work before equity was a hot topic. And for the past 20 years, we've been very focused on disability inclusion, particularly for young people and young people transitioning from school to whatever comes next, and that includes work. On the screen, you'll see LinkedIn or Twitter handles for our panelists, so please be sure to drop us a line as we go through the presentation. As you can see, we have an amazing panel, and we will get to them quickly. But first, I'm just going to introduce to you our papers so that Dr. Yin can present some data on those. So next slide, Fatima. Yes, tweet with us. #PurchasingPowerPanel. That's kind of a long one, but hopefully it works. IEL is at IEL Connects. AIR is at AIR Informs. And next, please. So Michelle hinted at this. We're going to talk about one of the 2 briefs that are on the screen right now, but you can find links to those briefs and more at each of our respective organization websites. A few years ago, Michelle and I collaborated on some national level data analyses about people with disabilities. And the first one was really around the wage disparities for people with disabilities. And we were pretty shocked to find that there was a tremendous wage gap still 30 years after the Americans with Disabilities Act, something around 37 to 38% wage disparities between people with and without disabilities. We went on to write a second brief nationally about the purchasing power of working age adults with disabilities. And then last year we published a couple of new iterations of those, but instead of looking at the national level, we looked at 10 major metropolitan areas to see how they compare. And Michelle is here to talk to you about the findings for one of those briefs, the purchasing power of working age adults with disabilities in Boston and other top metropolitan areas. So I will turn it over to Michelle now. Thank you.
Thank you, Dahlia. Next slide, please, Fatima. So like Dahlia said, we started this research series a few years ago with the goal to use easy to understand descriptive statistics to and publicly available data sets to help inform data-driven decision making for people with disabilities, for policymakers when it comes to disability employment. Before I started talking about the purchasing power, I want to share a little bit of statistics about the disability pay equity studies. We use US Census 2017 American Community Survey data, try to quantify the pay gaps between working age adults with disabilities and those without disabilities. Here we focus on working age adults between age 16 and 64 because we want to really quantify for those with same educational attainment levels, what is the pay differences from their primary employment. instead of looking at other sources of employment. And as Dalia mentioned, this is a second iteration of the earlier study where we use earlier data. And unfortunately, over the past several years, the pay gap hasn't been changed much. Next slide, please. There's about 37% pay differences between people with and without disabilities, and the earning gap widens by educational attainment. For those with less than a high school degrees, the wage difference is about $2,500. And in Atlanta and DC, as you can see from the top left corner, there's actually a reverse pattern. But when you're climbing up the educational attainment ladder, especially when you come down to the graduate degrees section, the pay gap significantly widens. In Boston, for example, people with disabilities makes about $45,000 less compared to those without disabilities. So we try to explore the mechanisms behind this and why do we see this pay gap? For one, people with disabilities tend to have significantly lower educational attainment. There's a higher concentration of people with disabilities have less than a high school degrees, and only about 3% of people with disabilities have graduate degrees, and compared to about 10-11% for those without disabilities. And because of the lower educational attainment, people with disability tend to be placed into entry-level jobs, and this is sort of characterized in the next graph. Next slide, please, Fatima. So next slide, please. Yeah, so here we show a heat map between the differences in percentage distribution of occupations between people with and without disabilities. So the darker green color, darker blue color shows higher percentage of people with disabilities in those occupations. And the green or yellow color shows lower percentage of people with disabilities in those occupations. So from the top, we see people with disabilities are more likely to hold jobs in transportation, material moving, office administrative support positions, and to the bottom in building and ground cleaning and maintenance type of jobs. But there's significantly less people with disabilities in management positions, right? The green and top, the bright yellow for Boston. It's almost 8% for Boston between people with and without disabilities in terms of holding management positions. So, and it's true that people with disabilities have lower educational attainment, which place them into lower, entry-level position. But it's also true that people with disabilities tend to work in positions that are not commensurate with their educational attainment levels. So the disability employment policy have been trying to improve, people with disabilities skills and their educational attainment, and our policy focus have been on trying to create more opportunities for people with disabilities in terms of connecting them with employers. It's clear that this has to be a collaboration between the public and the private sectors. So in the second paper, where we're going to focus more on today, we want to change our perspective of how we view people with disabilities. They're not only providing a unique skill set and knowledge and perceptions and insights in serving as a labor supply, right? But they're also consumers that will purchase products and goods just like everyone else without disabilities. So in the next paper, next slide, please, we try to use two measures to try to quantify the market size or the purchasing power for people with disabilities and try to see if there's a business case of hiring people with disabilities. So we use disposable income and discretionary income to try to quantify the market size. Disposable income is what we call take-home income, the after-tax income where you either spend or save. And discretionary income is the amount of money after tax and after expenditures on necessities like your rent, your utilities, and anything that you spend on unessential goods or services or luxury items are considered discretionary income. Let me give you an example. Dining in at home, cooking yourself is supported by disposable income. Dining out in a restaurant is supported by discretionary income. And because of the wide income gap, and you probably can guess that there is also a wide gap between those who have discretionary income by disability status. Discretionary income here are defined for those who have disposable income 30% higher than the average expenditures in their zip code. So we use the consumer expenditure survey administered by the Bureau of Labor Statistics in 2017 to try to quantify the average expenditure levels for your zip code. And if your disposable income is 30% higher than that average expenditure level, you will be classified as having discretionary income. Next slide, please. So here is a picture of the percent of individuals with discretionary income by city. And we can see about 8 to 12% of people without disabilities across cities have discretionary income. And when it comes to people with disabilities, only about 3 to 5% of them have discretionary income. Again, that's 30% higher or 30% higher of your average expenditures in the zip code you reside. And despite the difference, it's still a very sizable market that we're looking at. Next slide, please. This is a very busy table, but let's focus on the very last column where I show the average in the United States. So this is a table for people with disabilities only, and we also have a same table for people without disabilities in the paper for you to compare. For starting with people with disabilities, the mean income before tax is about $26,000. Again, this is only for working age adults between age 16 and 64 who are full-time employed. And after tax, their disposable income is about $22,000. And the total aggregated level, considering the population size, is about $500 billion in terms of disposable income that they can spend on services and products. And then in the sample, or among the population in our sample, there are about 3.3% people with disabilities have discretionary income. So again, those are the people with disposable income 30% higher than the average expenditure levels. And their mean income, again, among these 3.3% population, their mean income is about $183,000, and their after-tax income is $135,000. And we subtract the expenditures for their necessities to come to discretionary income level, which is about $60,000. And in aggregated level, again, times the population size, we're looking at $36 billion for 2017 alone. Again, this is a pretty sizable market. It's comparable to the Hispanic markets and the African American market in terms of size. Next slide, please. So we also try to look at the discretionary and disposable income level by disability type, because some business or industries might serve a particular type of disability, a particular individual with a particular type of disabilities. And here we see, for those with hearing disabilities, the top, the green and bright green line, and for those with ambulatory disabilities, the red lines have much higher discretionary and disposable income compared to those with self-care disabilities. And for business, again, if you want to target a particular market segments, it's important to look at them by disability types. So next slide, please. And in our paper, we also draw some conclusions and try to make something. I think we see there is a clear business case because people with disabilities hold significant amount of disposable and discretionary incomes to purchase products and services. And there are actually a lot of studies out there to show that people with disabilities and their families tend to be more loyal to brands and companies that provide accommodations and services that meet their needs. And there's also a strong spillover effect for people without disabilities when it comes to universal designs. And this is true across the literature. For instance, in education, children with disabilities who participate in social inclusive activities tend to benefit from those. But students without disabilities and their families also change their perceptions towards social inclusion after participating in social inclusion events. So we also offer some suggestions in terms of what business can do to better serve this population. For instance, it's important to hire people with disabilities, right? If you want to better serve this population, it's important to understand this population in terms of their needs and to have them help you design your products. And there are actually more companies begin to use inclusive marketing campaigns to try to attract this market segment. It is a really important topic, and I think our paper shows that not only people with disabilities are an important source of labor supply, they're also an important market sector that we should pay greater attention to. And with that, I'm going to turn it back to Dalia to start our panel discussion. If you have any questions about the paper, feel free to paste them into the chat box, or we'll have about 10-15 minutes at the end for Q&A. Thank you, Dalia.
And Dalia, this is Mia. We already do have a few questions coming in, and there were two specifically related to the briefs. So if it's okay, I'll raise those. The first being, I think when you were introducing the two briefs, we had Paula ask it, or she commented that it seems like the West Coast and LA have less of a disparity than the East Coast, and she's wondering if there is some reasoning behind that.
So most importantly, when we look at the education attainment and occupations, it's more likely to be driven by type of occupations and the business types. You know, in the West Coast, it's more tech driven. So, you know, there are less people with disabilities concentrating in those positions, in those industries. So their pay gap is less obvious compared to the, the West Coast compared to the East Coast, where the East Coast people with disabilities tend to have lower educational attainment and concentrating in jobs, in entry-level jobs where we see less disparities between people with and without disabilities. Again, our goal is to use descriptive studies and analysis and methodologies to try to quantify some of these issues. We can't really draw causal relationships between the pattern that we observe and any particular factors. We did try to use regression framework to see if demographic characteristics affect any of these pay gap. We controlled for age, gender, race, and some of the other demographics. It didn't really affect the pay gap differences. I hope that answers your question.
Thanks, Michelle.
I just want to add that we do have in the brief, one of the two briefs, focus on San Francisco. And so I encourage you all to go and read it because that was interesting. It reminds me of the data for Boston. And I would ask everyone to think really closely about the occupational chart information that Michelle shared. Managers are leaders in their organization. So if you don't have people with disabilities in management, they're not leading the organization, they're not hiring people with disabilities, they're not making as much money as others in the organization. So there's a lot of factors that interplay with each other. That's why I find the data that Michelle has analyzed so interesting.
Thank you both. And we have linked to both briefs and information about them in the question or chat area. A follow-up to that about the brief specifically is, or maybe it was regarding the slides, but if we could make sure we provide some accessible versions of those charts for folks who are colorblind, maybe in our follow-up, that would be good. And then someone, to your comment now, Dalia, just asked, what about entrepreneurs? So I don't know if you can speak to that at all.
We only look at occupations, not really by the industry or cannot go into the granular level of occupations because of the sample size, but that's a really good question. So we do know that there's significantly lower percentage of people with disabilities who are entrepreneurs, and that's true, I think, across cities. I want to say we have some information in the paper, but it could be in a different brief. But we have accessible versions of both research briefs, and we also have accessible version for the slides that we will share at the end of the webinar.
Great, thank you, Michelle. And Fatima, you can bring back up the slides. Michelle shared a lot of information very quickly. I really encourage everyone on this webinar to take a look and read the briefs, and then certainly email either Michelle or me with any questions. We will share our contact information at the end of the presentation. But now I'd like to reintroduce our panel. If our panel members would please start up their video cameras. As I mentioned at the beginning, we have some set questions. They will be on the screen and I'll read them aloud, but we encourage folks to ask additional questions. As you heard, Mia will interrupt us and add to the questions as we discuss them. So let's move right in, because I think the folks who are in our audience are really here for Steve, Apoorva, Howard, and Hale, and not for me and Michelle. So let's move right into the next discussion question, Fatima. So as you heard and read, the paper shows that there is a huge market of people with disabilities and their families, right? So if the average American family is 2.5, you're not talking about one person, you're talking about 2.5 times whatever numbers we saw. So from each of your business standpoint, what strategies have you engaged to employ this population, first as consumers and then as employees? And I'll ask Apoorva to start, because Marriott's doing some pretty cool stuff around consumer engagement, and I thought that'd be a neat place to start.
Sure. Thanks so much, Dahlia. Can you hear me okay?
Yeah.
Fantastic. Well, first of all, Dr. Yin, thank you so much for that excellent paper. That was very interesting and very eye-opening. And I really agree with the insights that are in there. Some of the things that we're very, very excited about at Marriott International, and some of the things that strategies that we employ is, first of all, making sure that our teams at our hotel, and they do, continue to understand welcoming all. Welcoming all, no matter who you are, where you come from, who you love, or what your abilities are. And that means welcoming all as a treasured guest, but also as an associate who works for our company. We have created many, many different programs, not just internally, to make sure that we talk about our culture of inclusion, but also externally with our guests. One that I'm just so excited to talk about is something called the Room for All. So for many of you who may have stayed in one of our hotels, and I hope many of you have and will continue to, you know, when you do check into our hotel, if you do request to have an accessible room, sometimes in the past in the industry, that room may feel a bit institutional, might feel more not as nice maybe as other rooms. Well, we want to change that. We want to make sure that our rooms are beautiful, elegant, functional, and able to be a room for all. So we engaged with many groups. One is Disability In, to really create, I would say, a cadre and focus group of people with disabilities. And when I say that, I mean diversity within people with disabilities, people who are blind, people who are deaf, people who use wheelchairs, to advise us, to talk to us about the experience from trip planning, through booking a room, through check-in, and everything to check out, everything in between there. The room, the exercise room, the eating, the how do you get services? Because we wanted to understand what that experience is like. And I'm a big believer in the phrase, nothing about us without us. And it was very important to us that we engage and learn from the community so that we could really create an experience that truly does welcome all. But it's also not just about the room. It's about how you feel when you come into one of our hotels. Do our associates at the front desk treat everyone with respect and dignity, right? So we train our associates on giving respect to all. And in some of those trainings, we have vignettes that show different types of experiences. And one of them shows an experience about people with disabilities. And it's very important that our team goes through that. In addition, we also do our marketing to make sure that we are inclusive and show folks from all walks of life. We're really proud of a recent campaign called The Golden Rule, which showed a business traveler who is deaf checking in using sign language, and our associate knew that this guest was checking in and worked really hard so that she could communicate with the guest in sign language. And it's something that we want to welcome everyone and make sure we give everyone a great experience. And we're going to continue to do this. There's lots of other things I can tell you, but it'll take up the whole webinar, so I'll stop there.
Thanks. And I'd ask the other panelists to join in. I know that Howard is very active in hiring people, so has Steve, and Hale at Fidelity is doing a lot for people of different ages with disabilities, so please. Oh, Howard, you're muted.
Can you hear me?
I got you now. Thanks, Howard.
Okay, good. So every location that Novo has business, anywhere from Pennsylvania all the way down to Florida, one of the things that I try to do always is to engage myself and partner with any organization that's dealing with individuals with disabilities. As a matter of fact, at 6:30 tonight, I'll be speaking with an individual out on the West Coast with the National Employment Team to find out more organizations that have people with disabilities who are looking for work in markets where we have business. If Wes Seaton is on the call today, I really appreciate that. Wes is the person who helped me in Richmond, Virginia, to partner with individuals who have disabilities. We have a lot of positions that are in our, I'll say our depot, where people are separating linen, getting it ready to be sent to the hospital. And those type of positions are tailor-made for individuals that are used to doing very repetitive work and work that's pretty exact, if you will. So one of the things we try to do is really to go out and quickly, as soon as we get into a new market, find out who the organizations are that have people who are being trained, that have disabilities that are being trained, that we can employ, work with. Coming from a nonprofit, I have a little bit of an advantage because I do know other nonprofits, and I do a lot of my recruiting by partnering with other nonprofits and working with people that way. So we've built that up. We are working with our managers here also to partner with the job coaches. So when we have someone come on board with a disability, we have the job coaches show our managers how to better interact with the new employees that we hire, making it very comfortable for both.
And Howard, I know you were just talking about partnerships, and Apoorva, you also mentioned partnering with Disability Inn. So I'll raise a question from Carrie. For businesses, what has been the role of community providers like job coaches and job developers to help in the hiring and having of employees with disabilities?
Who is that for? Me?
It's actually for everyone, but if anyone wants to pick that up, I think the question comes, there are a lot of folks from the voc rehab field on this call listening in, trying to figure out how do they find leaders like you to connect with, and how do they work with you? And so how have you worked with the folks in the field? It's sort of a reverse question. What have you done to work with folks in the field to bring in employees with disabilities? Hale, yes. You may be muted.
I may be. I am no longer muted. So, hey everybody, I'm Hale. I'm with Fidelity Investments. Here's what we've done in a nutshell. We have a hiring program we call Belong. And Belong is an inclusive hiring program. And the model is a little bit different than traditional programs. We start by finding managers. We find Fidelity managers who demonstrate inclusion and flexibility. And what we offer them is we promise that we can provide you with a highly qualified young adult with a disability who can help your team succeed. And when they say, okay, I'm in, at that point, they leave the process and Belong takes over. And that's where we start partnering with local organizations. And we go to those local organizations with a job description. And we say, we're a national, international company. This is a competitively paying wage. We're looking for somebody who's highly qualified that has these skills. And we have done our due diligence to ensure that whoever you recommend to us is going to be paired with a manager who is passionate about inclusion, all kinds of inclusion. And at that point, it becomes a very different conversation. Instead of people applying to jobs with a piece of paper, the resume through a system, and people putting out, like employers putting out job descriptions, a piece of paper on a digital system, we're now connecting organizations and and our job opportunities. And when they're able to recommend somebody who they know will succeed at Fidelity and they know will thrive, then that's an increased probability that we'll be doing the same thing again at the next cycle, whether it's 4 months later, 6 months later, 12 months later, whatever the case may be. So that's how we have been partnering locally. And that program, again, is called the Belong program at Fidelity Investments.
Excellent. Thanks, Howard. Yeah.
Yeah, if I can go back to my nonprofit days, one of the things that we try to do to market our services for having people with disabilities looking for work is we would go to our current employers. I'll give you an example. I used to work with State Farm when I was in Jewish Family and Career Services, and we provided people to State Farm who were customer service types, if you will. But just in our relationship with State Farm, we started speaking with them about our disabilities program, and coincidentally, the new CEO was looking to hire more people with disabilities. So one of the things I'm going to encourage you to do as nonprofits is to go to your current employers, talk to them about the program and how people with disabilities might benefit their organization. You might find business right there that you maybe never thought of before. You may be working with them in other type of placements, but talk to them about people with disabilities. Try to give them an idea of where they can fit, and work with the employers that you already have. On a larger scale, if you go to Google, you can actually, this sounds very simple, but if you just put into Google employers who hire people with disabilities, there's a large list. I went just last night. There are a large list of employers, Home Depot and several others, who hire people with disabilities. That opens the door for you to be able to go to those individuals. And the last thing I'll say on this topic is, as a recruiter, it is brutally hard right now to find people. I will guarantee you that a year ago, if you tried to pitch people with disabilities, you may have had a little bit of pushback. Right now, it's so hard to find people that if you can open the door to propose employees who are loyal, good employees, you will get the attention of people, because it's so hard to find people right now. That's just an untapped source that everyone needs to look at.
That's great advice. Thanks for specifics. And Steve, yes, you're a champion for hiring and consumers with disabilities.
Well, I mean, this was just a master class on how you can engage across all three sectors, right? Consumers, employers, and community. But for providers, I think to tell the story and the success stories in particular, because we know that there are a lot of success stories, and what we don't always hear so much is the quiet reservations that people might have, their lack of awareness and understanding. They think everything from additional investments and training. In some cases that's true, but in a lot of cases it's not true. So I think sharing the success stories of your clients matters a great deal. And then one quick point on the business strategy, specifically consumers and employers and employees. And it shouldn't be lost on us, actually, that those two are mutually inclusive, pun intended. I've experienced this at many stops in my own career, that if you're trying to attract a specific consumer population, as we're talking about a target demographic, employing people from that demographic is incredibly powerful, including that same demographic in your advertising campaigns. I distinctly remember during our time at Walgreens, and we had a store advertisement, and it was a person with Down syndrome, but it was not coming during disability awareness. It was actually part of our regular marketing. And the reaction that we received was extraordinary, because it was making that connection, specifically, as we all know, disability is a natural part of the human condition. And that, therefore, it should be reflected in all of the ways that we act, operate, engage, and behave.
Thanks, Steve. Fatima, let's move to the next question, because I think that's a nice segue, and I'm actually going to toss it back to Steve, because I want us to think about what you said. The CDC reported in 2019 that 25.5% of people in the US self-report that they self-identify as having a disability, but 62% of employees with invisible disabilities do not self-identify. There is so much stigma around this. And then we have other considerations. I mean, the question, how do you maintain a focus on consumers with disabilities when you have so much else to pulling on you? And how do you maintain a focus on all consumers with disabilities? That's people of color with disabilities, LGBTQ identified people with disabilities, people from all different parts of the United States with disabilities, immigrants with disabilities. I mean, it's, when we talk about 1 out of 4 people, we're talking almost about everybody, right? So how do you all maintain that focus? And if you wouldn't mind, Steve, getting started.
Well, I think a lot of it is specific to the numbers that you're referencing. You know, we know certainly from the job seeker standpoint, I call it the pause. Am I going to tell you about this or not? And this concern that if I tell you, it's going to restrict my opportunities. You know, as employers, we have to do a much better job of articulating, not that we are looking to hire people with disabilities, but why. And the why is, to me, empowering and inspiring when you think about it specifically in the context of what it brings to a workforce and a workplace. It's no accident that there is a spirit of entrepreneurship coming from the disability community, that there's a very short walk between the disability community and innovation. Because if you have to navigate the world with a disability, you have a skill set, actually, that most times we will miss because we're thinking more specifically about the opportunity. There's another important point here to make about a talent pool and the full utilization of that talent pool, which means that you by default are talking about people with disabilities specifically. The organizations that I see, not just with good employment practices, but sustainable employment practices, are making that argument specifically. Because if you don't, in some ways, I think it is perceived as an extension of corporate social responsibility, that this is a nice thing to do and an important thing to do. But as Apoorva rightly points out, this is a consumer base that we are trying to attract as well, that we know comes tethered, which is not always the case with consumer bases. So we know that unlike just about any other demographic groups, that those who are elderly, there's usually another consumer attached to them. Oftentimes, not the case for teens, for example, when their buying habits switch and change. So you're just not getting the customer with the disability. You're also getting, you know, the ecosystem of support and guidance that is around that person, you know, as well. And then I just want to double click on the innovation argument, because that is a critical one. And the narrative and the story is so important and so impactful. And there's so many wonderful examples. I distinctly remember during my time at Walgreens, and when we were actively, and the company still continues to actively employ people with disabilities, the people who were best at the job in the distribution center were people with disabilities. And it didn't change the job, certainly didn't change the pay of the job, but didn't change the job itself, the expectations. If you've been in a distribution center, those are time-sensitive places. Either you do the job or you do not. So there's no lowering of the bar of the standard. Well, as it turns out, when you adjusted the training specifically and maybe a little bit more time training, then the performance really ratcheted up. There's a lot of stories like that in supply chain and on the retail side too.
If I could jump in, Dahlia, you know, I agree with everything Steve has just said, and I think focusing on the value and opportunity that people with disabilities bring to places of business as an employee. I would echo, I think people with disabilities are probably the most innovative people on earth. Why? Because they have to be.
Because they have to be.
It is built into their nature to always be consistently thinking, what's next? What's next? Why wouldn't you want that talent in your business is the question. You know, show me the argument against that. There's inherent, amazingly, and unique value of innovation, of new thinking, new ideas. And, you know, we all work in competitive industries. It's innovation and new ideas that help propel your business. And to do that, you need to think differently. And I think that's something that associates with disabilities bring to the table every day of the week. You know, we work very closely with the Marriott Foundation has a program called Bridges from School to Work, which helps to find great jobs for people with disabilities. And we work, it's not just to fill the pipeline to Marriott, it's also with companies that have been mentioned here, Home Depot and others, to find amazingly great opportunities to for employment. And what we find is not only, to Steve's point, are these amazingly talented individuals, amazingly loyal, amazingly hardworking, and bring so much value to the table. So I think that's I think it's a shift on how people need to think about this. And then the other thing I would say to this question, the need to maintain the focus on consumer with disabilities, the numbers don't lie. The numbers in that study don't lie. There is significant purchasing power of this group, and you get the extensions as well, right? I remember, when my daughter wears cochlear implants, when we go to a place of business and they treat her with respect, I remember that. And we'll choose to use that company or that service again because of that. And it's and if for us in hospitality and the welcoming all business, that's just what we do. That's what we pledge ourselves to, and it's our culture of welcoming all.
It is. It's brand loyalty, and I'm so glad you went back to the numbers, because I was at a conference and someone from American Airlines said we need numbers to make the case to the C-suite that it's worth investing in certain types of accommodations in order to bring in more business. And so that's what I'm hoping things like that brief that we produced will help folks do.
Yeah, I think so. And I think it's two things. One, it's the right thing to do. And hopefully everyone gets that. But also, I love when the right thing to do also brings you great business success. That to me is a beautiful combination that usually elevates things when you get into the boardroom. But I think it's that combination. And at Marriott, we say we put people first. And if we're going to live up to what's on that wall, we want to do it every day of the week.
Great. And I know Hale and wanted to speak, and then Howard, please.
Okay.
So this is Hale again. So first, I love what Steve and Apoorva said. Couldn't agree more. What I'd like to focus on is a little bit different. And yes, let's go back to the numbers. It's very compelling. 1 in 4 people have a disability. But sometimes people don't believe the numbers. And I've had conversations where I've explained 1 in 4 people have a disability, and then I say, and that's according to the CDC, the CDC, and people still don't get it. And the reason they don't get it is they think about, as we all do, their typical frame of reference. So what we found is very helpful in maintaining the focus. There's a couple of things. First is pointing out that at 1 in 4, you're now talking about the largest minority group in the world. The largest minority group in the world. So anybody who cares about marketing and customers and segmentation say, oh, well, here's something that can appeal to 1 out of 4 of the people in the world. That's a good place to start getting attention. And if they still don't believe the 1 in 4, we like to break it into 3 pieces. First is invisible disability. That's 70% of disability. You don't know what my disability is unless I show you or I tell you, but it's there. And that means it's among all consumers and all employees across the country. So that's tranche 1. Tranche 2 is people age into disability. And 70% of disability is due to what my friend Jeff Whistle calls the glorious aging process, right? By the time we're 65, 1 out of every 3 of us will have significant vision, hearing, ambulatory compromises where we will rely on assistive technology. Maybe not today, but it's coming. If you think you're able-bodied today, that's temporary, right? And then the third tranche is this awesome youth movement where ever since the ADA passed in 1990 and public education had to be accessible for young people with disabilities, just imagine in 1991, a surge of kindergartners, pre-Kers, first graders, second graders with disabilities. They have access to education where they may not have before. And like a pig in a python, they go through the system, and 10, 12 years later, they're entering college. 4 to 6 years later, they're getting master's degrees and entering the workforce. And then what this means to the US economy is that over the last 15 years, every single year, there has been a steadily increasing number of highly qualified young adults with disabilities that are workforce ready and growing and earning power. That matters to all employers. that matters to all providers and goods and services looking for people to buy them. I mean, this is an empowered cohort that's growing in size every year. And that's how we like to think about the best ways to maintain the focus on consumers with disabilities. Because if it's something you're not looking at, it's really easy to, dismiss. And then we find that arguments like that help bring it back to the forefront.
Thank you. And Howard, you wanted to add?
Yes, I just wanted to add that here at Novo, I'm not sure that our hospital clients choose us because we have people who have disabilities, but I will go back to my experience at Jewish Family and Career Services. I can't tell you how many times we would take an individual, a family would bring in their teenager or young adult. We would take that individual, train them, and help them to go out and find a job opportunity. I will tell you that parent was now loyal to that company that gave their child a chance and gave them an opportunity. They told their friends about it, and then it just builds on and on and on. People want to deal with organizations that have a heart and that will give their people a chance. So I would say from a business standpoint, working with people with disabilities, as the panel has already mentioned, is a good business reason. That's something that is a very good business reason, bottom line business.
Thank you. Next slide, Fatima. This is a great conversation. We'll keep it going. I know Mia's also tracking the Q&A online, but reflecting on the events of the past year, in light of the racial tensions that we're facing in our country, I would say finally addressing in a deep way. A lot of people are remote work, but not everyone. A lot of mental health challenges. I've certainly been challenged in this way. And then the health pandemic. How have these challenges and intersections affected your inclusion strategies?
Well, Dalia, I would say that certainly in my role as a CHRO, it is a daily topic of discussion. I wonder if in the history of work, has there ever been this much conversation and awareness about mental health in the workplace? I don't think so, for reasons that are self-evident. I do think that we're all thinking more along the lines of intersections, specifically. Intersections of racial tension and disability. So for example, when we have seen the regrettable policing of African American people, it should not be lost on us who have long been advocates in the disability community that a number of those African American boys have a disability and were not able to express themselves to the police in the way that the police thought they should. And in a couple of instances, it cost them their life. I worry sometimes that we get lumped into this single definition of the label when the fact of the matter is that we are all multiple in our dimensions. And so over the years, I've watched cause-related conversations that really step too close to the line of my cause, my demographic is the struggle is greater. When in fact we are all bound up together. I think the pandemic has heightened greater awareness. It's, I think, required us as employers and as citizens to think a bit differently about what it means to be an ally. So I actually literally had a people leader call yesterday, and we devoted the entire conversation to what it means to be an ally. And so I think people would expect me, to take a strong stand on matters of race as an African American. But what they might not expect is for me to take that same kind of stand for people with disabilities. I've never really bought into this idea that somehow we don't have the ability to understand one another's struggle. If you're a human being and you walk this world, you breathe this air, you've known struggle, you've known adversity, and therefore, because you absolutely have the ability to understand what it is like to be part of a population for whom the unemployment rate is double that of the national average, which is the case for people with disabilities. You don't need to have a disability. You don't need to be raising a child with a disability to be an ally for those kinds of engagements and interactions. And lastly, I would say on matters of tension and how does any society change? Is it simply the rightful protest of those who are affected? Yes, that's part of it. But the real history, it is the allies specifically who come to stand shoulder to shoulder with their colleagues, with their friends, with their employees, with their consumers, and in a lot of cases with their family to say that this will no longer abide. That's how change not just happens, but is also sustained. And lastly, I think happening with employers specifically, because if you look at recent research, our citizenry does not trust politicians, does not trust national voices, does not trust the media, but they tell you who they do trust. You know who they trust? They trust their employers and they trust their bosses. That's where trust is in America today. So we have this ability to impact and influence those conversations with the things that are right around us. So I know we see so much dissonance and discord, polarization, and it is fatiguing. We've got to put on a certain kind of mental armor to navigate it. But look for the lighthouses, and the lighthouses are most likely to be found in your local community. They're all around us.
Thank you so much. I feel like I could say so much, but I think Apoorva and Hale wanted to say some.
Sure, Hale. Oh, thank you. I'm a hotel guy, so I'm always after you. This is such an important question you have here, Dahlia. I mean, when we think about the last year in particular, when I think about the hospitality industry, you're right. The challenges, we have had a pandemic, we've had racial tensions or racial issues, and let's be very clear. What we just saw recently, this has been going on for a long time, right? But it just really got to a new level of awareness after George Floyd's murder, right? So you think about a pandemic, those tensions, and for many of you, and also for sure in the hospitality industry, people worried about their jobs, making a living, right? And when you put all that together, the strain and stress that people are having has been something I've never seen before. And it's right. Everyone interprets this differently based on their own experience. And I agree with what Steve is saying. Everyone has their own experience and their own walk through life and their own struggles. And it's not good to play the comparison game. We're all in this one together, right? And the only way we're going to get out of this is together and by understanding and helping each other. So the way this has affected our inclusion strategies is we're really proud of the work we've done for 90 plus years, but it really said, hey, we want to be even more overt in what we're doing. And also make sure that we are taking the time to listen to our associates and go like this and here, listen first, right? And then work with our associates at all levels of the org chart, of all backgrounds, to ensure that they feel heard, feel empathized with, and feel that they are part of the solution, right? That last part is really important, because sometimes places will just say, well, we're going to go off and hire so-and-so to come do this, and they're going to come out with some program that's going to be wonderful. Sometimes they are wonderful. Sometimes they miss the mark. Sometimes those solutions come from within and can really have an impact and build that feeling that, hey, I'm part of the solution. And my goodness, the ideas you get usually from your employees usually are the right ones. I really believe that.
I'm just so glad that you brought up the word empathy in a workforce context, because I think the strongest workforces are the ones where there's empathy all around. Hale, you wanted to add? And I'm muted telling you you're muted, Hale, so.
Okay, I unmuted and then I was remuted. I'll take that as a warning. I'll be brief. First, Steve touched on mental health, and one of the things that I want to share about inclusion is that mental health is more pervasive now than ever before. We know that, but the way we can quantify that is every year we talk with all of our institutional clients and we ask them, what's important to you now? Is it retirement risks? Is it total well-being? Is it cost of investing? Like, what is it? And for the first time in history, mental health is one of the top 6 topics that employers are highly concerned about this year. And the beautiful thing about mental health is it is completely non-discriminatory in terms of who is impacted by it. It doesn't matter your age, skin color, anything, gender, doesn't matter. So in that sense, it can be a unifying factor. So that's the first thing. The second thing around intersectionality is after a few years ago, we set up this office to focus on disability inclusion and accessibility and found that it's hugely important to our customers and to us. We have since created an entirely new and much bigger office that is all about advocacy for underrepresented customers, which is an inclusion strategy. It's less of an inclusion strategy for our associates because we already have employee resource groups and other things. We've been very robust about inclusion for our associates. And we are shifting so that we have committed inclusion strategies for all customers, including this new group that specializes in advocating for traditionally underrepresented customers. So we're offering them what they need and value.
Great, thank you. I'm going to move us on. Oh, Howard, yes.
Real quick, I just wanted to say that one of the things that we're working on here at Novo, and I have to give kudos to our HR manager, Michelle Dyer, we're working very hard on training our managers. It's one thing to bring people in that are of different backgrounds and disabilities and different races, but if your managers don't know how to speak to people properly, don't know how to interact with all the different type of people we have, then we failed. Because if our employees aren't happy and they're not expressing that happiness to our customers, we look at our customers as number one, our employees, our team members as number 1A. We've got to make sure that those individuals are very, very comfortable. And so we're working very much with our managers on training them how to speak to people, how to interact with folks. A lot of our managers here became managers because they were very good at their craft, not necessarily because they knew how to manage. So we're not really doing a great job by putting someone in a position and not giving them management training. It's not fair to the people they manage, nor is it not fair to them. So Michelle's working very hard to put together some really, really strong management training and showing people how to interact with their staff, which hopefully will make this a more inclusive place to work as well.
I'm so glad you brought up management training for managers, because it's not a one-time awareness raising. It's ongoing for all of us to continue to raise our awareness as things continue to evolve in our society. Next question, Fatima. We treasure what we measure. That's an old adage. I'm wondering, what are the metrics that your organizations use to measure progress? And less about the numbers and more about how do you share that internally to help your internal organization understand and value it? And then externally, how are you sharing those metrics to show people that you value inclusion of people with disabilities on both ends? I see Hale smiling, so I'm just going to ask him to get us started.
Hi. So yeah, this is Hale with Fidelity. I'm smiling because of the intrigue in the question. Fidelity recently published a diversity and inclusion analysis of what we're doing about driving inclusion internally, and it's publicly available, and everybody can see it that wants to see it. And that's about our culture as an employer and as employees. When it comes to sharing externally, I'd say we're a lot more cautious about that. And the reason we're cautious about that is because those of us who are deeply committed to this space, we're very proud of what we're doing, and we're very excited about what we're doing. But stepping outside the walls of the firm to talk openly about that, it's a lot like stepping outside of your firm and talking proudly about your cybersecurity capabilities. You know, you're inviting the bad guys to attack you. And what we found is that the moment that we start saying, all right, look at us, and we try to turn it into an ad or marketing or some kind of brand leverage thing, that it's going to come across as insincere. And we just care a lot more about getting it right and getting it quietly right and trusting that people who care will recognize than we care about advertising what we're trying to do. And that's why if you do a Google search for the Belong program that I mentioned earlier, nothing's going to come up. It's nothing we advertise. It's just something we believe in. If that comes across as unhelpful, I'm very sorry. I would love to talk to anybody who wants to learn more, but we just don't believe that this is the kind of thing that you advertise. It's just the kind of thing you do because it's the right thing to do, and the customers who care the most decide loyalty because of that.
That's a very honest answer, and I appreciate it, because I do think when you're not on the business side, I, for one, looking at a business, I am going to make judgments based on what they share about that employment. And I'm not necessarily going to hear the message, we're striving to do better, and necessarily interpret it without a bit of cynicism. So that makes a lot of sense to me as a consumer.
I might jump in and add, I think there's two things that come to mind. I'll answer the internal and then the external part. Internally, we measure, internally progress. I agree, what gets measured gets done. And one of the really, I think, good approaches we use is something called an associate engagement survey, right? And the reason we like engagement is because, sure, you can measure people, numbers of people, which is important, right? But the thing is, but how are they engaged? Do they feel like they belong, right? Belonging is an important word. Do they feel that they're welcomed as an employee, but also is in a meeting, do they feel that they matter, that they have a seat at the table, that they can contribute, right? It's like what they say, diversity is being invited to the dance. Inclusion is being asked to dance, and belonging means you can dance like no one's watching, right? We want everyone to feel like they belong and can express themselves and not feel judged, right? Because that to me is where you want to be, right? Because then these are folks who want to work with you, work for your company. They want to stay, have great long careers and do great things for themselves and for your business. So that's and this survey happens every year. It's tracked by it's anonymous, right? But it's tracked, well, I should say it's anonymous to me, but my team's results get anonymized, and then I get graded on it. HR sits with me and says, hey, Porva, here's some things we're hearing. This looks really good. Can you please talk about those best practices with other people? Here's a few things that you need to work on. And the company gets graded on it. I get graded on it. And when I get graded on it, that impacts my career, my pocketbook, etc. So there's a way that it incents me. Hopefully I'm doing it because it's the right thing to do, but it also incents me as a professional. That's the internal part. The external part, one of the things we're so proud of is we participate with Disabilities, Disability Inclusion Index, DEI, right? It's fantastic. And it's something that helps us, kind of work to make sure that we are looking at our policies and to make sure that we're doing everything we can to be the best we can be, and get an honest outsider look also to say, hey, look, here's some great things you're doing. We love it. Here's a few other things you should think about. The DEI has been so helpful to us and helping us really get that view. And look, we're proud of how we've done, but we always know that success is never final, and the DEI helps us do that very, very much. So that's kind of an external way that we kind of grade ourselves, is with the help of Disability In.
Great.
If I could add just on the metrics part quickly, and this is with the WorkHuman lens on. So WorkHuman, we literally power the recognition platforms of companies all across the world, and reimagining metrics specifically in the context of recognition is so powerful, because fundamentally that is what the conversation's really about. You get from diversity to inclusion by recognizing. You recognize humanity, you recognize the contributions of all. In our world, we have the ability to see who gets recognized for what behaviors, what values, at what amount, and is there consistency in recognition, specifically. And so then that gives us the ability now to go to Hale, go to Howard, go to Michelle, go to Apoorva and say, here are your strengths. Here is what you're doing well. And here are opportunities for success. One of the things that has to be reimagined about metrics is we've got to interrupt the thought process, because in all candor, a lot of the damage is already done. And whether that's true, whether you're talking about retention of people with disabilities, glass ceilings, it's not until we've left organizations because of a lack of advancement opportunities. Technology and platforms gives us the ability to assess that while it's happening and interrupt it in that moment, and not after we've had an adverse impact analysis or been on the receiving end of a class action lawsuit.
Good point. I'm going to move us, because of time, I'm going to skip question 5, Fatima, and move on to question 6, because this, to me, is the big takeaway from one of those 2 briefs. It's really about management level. It's about career advancement. When I was at a conference a couple years ago, and a gentleman said to me, look, I did not tell folks I had a disability before they hired me. And once they hired me, I needed all these accommodations, and they provided me with the accommodations. And I thought, where's the problem? I'm waiting for it. And he says, so should I have told them? And I said, well, I don't know if that's the question anymore. You have a job, entry level, but they're giving you everything you want or you need to do your job well, and you have the resources. What's the next step? What's your advancement look like? How are you moving to the next level? And he looked at me really kind of surprised, like that hadn't occurred to him. And I think what this question is really speaking to is a culture of low expectations for people with disabilities, and that this webinar is part of our Raise the Bar series. Like, let's raise the bar for people with disabilities. It's not just about getting a job. It's about having a lifetime, a career, and making an impact. Work is so meaningful for each of us. So back to the question as I stop orating. What are the career advancement opportunities for people with disabilities in your organization, and how are you making that happen?
Hey, this is Hale. I'd love to jump in on this. There's a couple of things. I won't recreate all the research that correlates innovation with the inclusion of diversity, but firms that want to survive in the long run and thrive in the long run are investing in innovation, in the ability to reinvent themselves. And it seems lately a great strategy to tap into innovation is to tap into diversity and to authentically include that diversity in decision making. And with that in mind, one of the things we're doing is, and this has to do with job interviews, for example, it's critically important that there are underrepresented candidates that are advancing in each round of the interview process. That's one thing, because that ensures that we're becoming more diverse over time. The other thing is, what is the organizational perspective on disclosure? And what I like to share when I'm asked, and I will say this is my personal opinion, this is not an official opinion of my employer. My personal opinion is that whenever you have an opportunity to disclose a disability, you should take it. And the reason you should take it is because it's an opportunity to learn if the place you're interviewing for puts a premium on diversity and therefore on inclusion. And if they don't know how to handle the question, they probably don't, right? And if you are already working at a place and you're wondering whether or not you should disclose, I would just offer this: by disclosing a disability, imagine you're struggling at work, and maybe that's related to a disability. By disclosing that, your profile changes from somebody who's a struggling employee and we don't know what we can do about it, to a struggling employee who is now asking for accommodations and who is part of a protected class. And now it's just a very different conversation. So those are the two things that I would emphasize. The first is like a firm thing, which is making sure there are diverse candidates that are advancing at every stage of the interview process. And the second is disclosing, and disclosing confidently, because it's not just about you exposing the vulnerability, it's you interviewing your manager and your prospective manager about how inclusive they are.
Really great points. Apurva and I are watching the ASL interpreter. We're bilingual. Did Apurva, Steve, or Howard, would you like to add to that?
Yeah, I mean, I'll jump in. I think, to this question, I think Hale is 100% right in what he's saying. And I think, at least in Marriott, there are grand opportunities. We have people with disabilities at all steps of the organization, at headquarters, at our properties, and in between. I think one of the things that makes me very excited about it at Marriott is just the nature of our business. We have so many different disciplines that people can work in and be successful, right? Think about as you, when you go to a hotel, what are all the different things you see? You see, folks at the front desk, you see servers, you see our housekeepers, you see the management of the hotel. And then you also have this whole headquarters function, right? That has all the typical disciplines. But that's also, at least at our business, huge, and we talk about innovation, huge opportunities for us to continue innovating. Look at what this last year has given us. It's been super hard, but it's actually jump-started so much innovation into how we can ensure that our hotels are safe and feel safe for everyone, right? Cleanliness, so many other things. And for us as a company, as we look to welcome all and welcome folks from all different types of walks of life, we need folks from all walks of life to be part of our company to help us do that, right? You need people who are deaf to help you understand how best to better the experience for travelers who are deaf, et cetera, et cetera, et cetera. So I think the opportunities are immense.
Hey, Dalia. Oh, I'm sorry. Go ahead, Howard.
Oh, no, I was just going to say that here at Novo, one of the things that we try to do is the individual who we placed here back in 2016, who, by the way, has one of the longest tenures of any of our employees here. He started off as a driver's assistant. Frankly, a lot of people here don't even know that he has a disability. It's an intellectual capacity disability he has. Most folks here don't even realize that. But he started off as a driver assistant. Now he's working in a capacity where he's actually doing a little bit of training. People who start off in our production area also have opportunity to work in the hospital. So we definitely have a situation where our growth here is not just straight up and down. It can go sideways. So just because you start off in production doesn't mean you can't work in a hospital capacity, doesn't mean you can't work in other areas as well. So, with Novo, the working with people with disabilities is still fairly new and still a work in process. So we're really developing it as we kind of go along. But we found that the opportunities that we have for people, we placed another gentleman in our Richmond office. And I don't know if the other people on the panel have noticed this, but people with disabilities, sometimes the other employees kind of take them under their wing. They really, really work well with them and take them under their wing. They're very protective of those individuals. And that puts them in a position where they have a lot more confidence, not just in their work, but also in the camaraderie they develop with their coworkers. And has also increased their opportunities for growth as well.
Yeah, I would add a quick 15-second point that you always do have to do an internal pressure test on your own mindset. Is there indeed a culture of low expectations, or a here but no further in terms of our perception of the opportunities for people with disabilities? Because sometimes that does happen. Fantastic in a role, great in a role, but we don't really have a vision for you beyond that, which might not square with what that employee's expectation is. It's all part of the human experience, though, right? And how is those expectations any different? They're all the same. We all want to advance and achieve even higher levels of independence.
I think that's right.
I'm sorry, I got to pile on too. I love Howard's point about there's an opportunity for colleagues to demonstrate that they care, to show their best side, their most inclusive side. That's a phenomenon that me and a couple of people that were very early in this movement at Fidelity, we call it collateral angels. You know, you create this work experience and you wonder, oh my gosh, I hope this is a really good experience. And then sometimes it's the most surprising people who step forward and take on a role of big brother, big sister, inclusion champion. And it's just a beautiful thing to see people able to show that side at work.
You know, I agree 100%. And Hale, every time you talk, it makes me so happy that all of my investments are with you at Fidelity. That makes me really happy. I go to your website every day, trust me. I love what you're saying, Hale, because and Howard, because I feel there have always been people who want to be allies, but gosh, I feel in the last year that number has just risen. Who folks are saying, you know what, I want to be part of the change. I want to make a difference. I get emails every day from people say, hey, I want to be, they'll say, I'm not Black, but I care about the Black experience at Marriott. I want to be a part of that solution. And it's emails like that which make me really happy. And I think Howard and Hale are 100% right in what they're saying about, that people will step up. And I think you're going to see more people step up. And you're right, it's a beautiful, heartwarming, and important thing.
Thank you all. We're going to move on to the last question on the next slide, Fatima. And this is a really nice segue because each of you are leaders in your organization. Each of you have a role around diversity, inclusion, equity. But I'm wondering, how do you show up as a leader in your organization that really focuses on that disability inclusion? Maybe the real question behind this is, what's your why? Why is this important to you?
That's a great question. I'm happy to start if you like, Dahlia. I think, how have I shown up as a leader? Look, I mean, everyone has their own life stories, right? But, coming from an immigrant family to this great country, growing up in an Indian household, going to quote American schools, being bullied as a kid, always being made to feel not included. That's something you remember. Right. And, as they say, when you're bullied as a kid, that's a feeling you never forget. No matter how old you get, you never forget how that feels. So not being included has been part of my life. Right. So I think to me, it's very, very important to me that, and I feel very honored and blessed to do this work where I get to focus on helping people be included. Right. Well, what does that take? It takes standing up in meetings. It means speaking truth to power. It means, but doing it in a productive manner. And it also means understanding this great study that Dr. Yin put out today, right, that talked about, and being ready to talk about this work and talk about it in a way that shows that not only is it the right thing to do, it's good for our business. And it's all, I think change happens sometimes in small, it can happen in small conversations. It's not always about the big speeches, and those are important, but I think change sometimes happens in little ways. And sticking to it, keeping at it, talking about, like for us, why the room for all makes sense. Why does it make sense? How does it fit our culture of inclusion, right? How it bakes into that. It's not additional. Sure, it's more work, but it fits into something of what your company or what you stand for. That's how I think I've shown up, and I can't wait to keep doing it.
Thank you. Howard, please.
Yeah, I'll just say I've been down here in Georgia since 1995, and not to disparage Georgia, but I'm originally from Connecticut, and I graduated from college in New York City. So diversity has been in my blood. New York City being such a diverse place, and being down here in Georgia, it was getting there. It's going to take a little while longer, but it's getting there to some extent. But one of the things I try to do in terms of working with the other HR people, as a recruiter, I work with other HR people with Novo across the country. I try to introduce them to resources that maybe they haven't used before. And again, one of them being the Urban League, the Organization with Disabilities, places that they've never thought of recruiting from people before. So as far as being a leader, I try to lead by example by saying to the folks, look, here's what's worked for me in Atlanta. I found an organization in Richmond that can work for you. I found an organization in Mason, Ohio that can work for you. So now that's going to open the door for them to be a little bit more open-minded about some of the organizations they work with and giving people a chance that maybe they never thought of before.
No, yeah, I would add that my why is just anchored in this turning point in our own history as a society. We are a nation in desperate need of a national narrative, of a more common narrative that is not to be defined by the label that you come into the world with, over which you had no say, but this deeper human experience that connects and touches us all. These kind of universal stories of family and faith and fortitude and forgiveness and love and loss that, you know, you breathe this air, you walk this world, those are journeys that we all have in some way, shape, or form. And in some ways, I find that the why, specifically the why around disability, is a way to make all of that real and tangible, because it's a measure of any society, how you deal with often the most vulnerable amongst us. And therein lies the character of a nation, you know, specifically. We all do have our personal stories, of course, but we can also find chapters of somebody else's story in our own. And that is not to be found necessarily in race or gender or being differently abled or your religious expression, or and definitely not who you voted for. We have these opportunities to find these more common narratives. And for our children and grandchildren, that is particularly important, because that is the world that they are going to inherit. And they are looking to us to provide different answers than they've been getting from our generation to date.
Yeah. This is Hale. I'll add really quickly. This feels like a trick question because it says how, but you interpreted it as why. And I guess the why.
Throw you a loop, yeah.
I mean, the why is that leveling the playing field is just the right thing to do. That's the antidote to privilege of all kinds, right? So anytime we're leveling the playing field, it feels good. It's the right thing to do. In terms of the how, one of our favorite things to do is talk about the curb cut effect. And if disability inclusion is the opportunity, accessibility is the answer. And when you get that right, you're not just solving for people with disabilities, you're solving for everybody. It's a better experience for everybody.
And I will add, and I'd like to ask Michelle Yin the same question. So I grew up in a deaf family. My cousins have all different kinds of disabilities. For me, that was quite normal. So to then enter the real world and find out that there are a lot of people that think disability is something odd or different is very surprising, right? I would like for everyone to have had that experience I had growing up, thinking that disability is just part of the natural part of your day-to-day, because once you realize that, you realize there's nothing special in a negative or positive way. Disability is just another characteristic of who we are. And Michelle, did you want to add anything?
No, I really appreciate this conversation. You know, I've been working in the disability research field for a long time, and I've had a lot of conversations with people with disabilities and policymakers who really genuinely care about this topic. And we all have friends and families who have disabilities. So it's not a topic that's foreign to any one of us. And I think it is a topic that's related to our daily life. And everything that we do for people with disabilities ultimately benefit the general masses, right? You know, everything that we design for people with disabilities help improve technologies and help improve user experiences. So I don't think we're doing just for a particular subpopulation. I think we're doing something for all of us, because we don't know, one day we might become disabled or age into disability. So I think that's something to think about all the time. And I just want to add that we have several research briefs coming out, and one on racial differences in vocational rehabilitation services, and one on return on investment of VR services. So we'd be happy to share those with our audiences, and please feel free to reach out to me and Dahlia if you want to learn more about our research, and stay tuned for future studies from all of us.
I want to close out the panel just by saying I picked up this book called No Pity by Joe Shapiro. It's 30 years old. It was written right after the ADA was published. And as I'm reading this book, I'm realizing all the issues we had in 1994 are the same issues we face today. Lower education outcomes, lower employment, wage gaps. And it's very easy to be cynical and say 30 years ago, what's changed, right? We're facing the same challenges, and yet so much has changed. And the reason why I'm so hopeful is because we have leadership who cares about people with disabilities. That includes the gentleman who were so kind to join us today. We have advocates and activists. Like Hale said, we have a young generation that's coming up that is expecting inclusion. It's an expectation. It's not different. It's what they grew up with. And we are all raising those expectations, including the folks in our audience. So I want to thank you, Hale, Steve, Apurva, Howard, and Dr. Yin for your time today. This has been a fabulous conversation, and I really appreciate you all. Thank you.
Thank you, Dahlia, for moderating the session.
And thanks to the audience. We do have an evaluation form for you. Please look for that. We will email it to you.